Hi everybody, this is a video about the herb Cryptolepis. I posted a video about this herb a few weeks ago or so, give or take, and basically talking about how there's some in vitro research studies showing that Cryptolepis seems to be the best herb for treating Borrelia, i.e. the microbe that causes the bacteria that causes Lyme disease. It seems to be the best herb to treat Borrelia in its active replicating form, in its round body form, kind of like a dormant form, and then also when it's hiding out in biofilms. They've published some other evidence that it seems to be the best herb at treating Bartonella as well. And so there's a follow-up question based on that. Video that I sent out. And so just before I get into that, if you don't mind taking a quick second to like or share or subscribe or post a quick comment on this video, I'd really appreciate it. So thanks in advance for taking a second to do that. And also, as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So the question that was posted is, I am starting this herb, Cryptolepis. I am very hopeful because of the research article by Feng et al. In 2020, so one of the studies that I mentioned. I have Lyme/Morgellons, but no diagnosis. Do you suggest taking any other supplements along with it? So again, per usual, can't actually make any recommendations for supplements or whatnot, but I can kind of speak generally about this topic. So while Cryptolepis does have the strongest in vitro research showing its effects against Lyme. And as far as Morgellons goes, to my understanding, the most compelling published evidence suggests that Morgellons is actually driven by Borrelia, the bacteria that causes Lyme. So they seem to be kind of one and the same, or have a common root cause. Even though Cryptolepis does have on paper the strongest impact, I never use Cryptolepis by itself. I can't think of a single patient where that was the only herb that I recommended for someone. I personally always recommend herbs in combination. And even though an herb like Cryptolepis is very broad spectrum in terms of its activity, like we know it has anti-parasitic effects as well. I've seen it be very helpful in cases of mycoplasma, Lyme, Bartonella, Babesia, and I don't know to what extent it has antiviral properties to it. I'm not aware of it being a super great antiviral, but who knows, maybe it is. We've certainly learned over time that certain antiparasitics have antiviral properties to them. But I don't use Cryptolepis by itself. I always use it, or virtually always use it I always use it in combination with something else, and that's virtually always in combination with other herbs. I've talked about these in other videos in the past, but some of my top favorites, all of these inspired by the late Stephen Buhner, this amazing master herbalist, brilliant guy, and he passed away, I think, earlier in 2023 or late 2022. I don't remember the exact date, but wonderful books about Lyme disease and co-infections. Highly recommend those books. He has some further books. One's called Herbal Antibiotics, another one's called Herbal Antivirals. So if you're interested in these topics, you can read all about them in those books. There's e-versions that are available, so they're wonderful resources. But some of my top favorite herbs are, in addition to Cryptolepis, are Alcornia, Sida acuta, Japanese knotweed, cat's claw, one called Hutunia, Chinese skullcap, and Isatis. So those are my top herbs, and I usually recommend all of those in combination, typically in an herbal tincture form, and recommend that to patients. I always appreciate the questions on my videos or comments comments and questions, but I always appreciate the questions. Please don't bother asking me for dosage recommendations, because I'm just not allowed to give those recommendations over social media. You're more than welcome to post that in the comments section, but I will politely say I can't give you this information. So you have to talk to your healthcare provider about specific dosing. But those are my top herbs that I recommend. I usually recommend them all in combination. Not everybody tolerates all of those herbs, so sometimes we have to kind of mix and match them in different ways, but ideally we have patients on all of those herbs and we get this nice synergistic effect. So in terms of other supplements that I might recommend over and above the herbs, again, I've talked about it in other videos before, but we really want to think about not just killing the infection, but also modulating the immune system, kind of getting that back on track, repairing damage that's been caused by the infectious microbes as well. So I recommend other things in addition to Cryptolepis and all of its other herbal buddies. Yes, oftentimes we need to use a multi-part protocol. Not everybody needs that. And if they're early enough in their infection stage, like if they've, quote unquote, only been sick for maybe a few months, maybe even 6 months, we can sometimes just get away with the herbs and that's it. But if it's been festering for, months and months and months, years and years, sometimes decades. Like, it's quite rare that we can get away with just the herbs, even wonderful herbs like Cryptolepis. So thank you for the question. If anybody else has any questions or comments about this topic, please post in the comment section below. If you yourself have used Cryptolepis, or you found that using a single herb was the cat's meow for you, or anything that I said you have kind of a different experience with or different opinion on, by all means, please post in the comment section below. I love to hear what folks are experiencing. I become a better clinician when I get more feedback from my patients, of course, but folks who can share their own clinical experience if they're like their experiences as patients, or if you're a clinician listening and you want to share a clinical experience, I'm happy to hear that too. Great to hear other experiences and feedback and all of that. So thanks again for the question. I'll leave it there for now.